Good morning and good afternoon. Welcome to our December Willis and Friends. This is our 7th session for this year, and I'm thrilled you're joining us. Our Early Relational Health Coordinating Center at CSSP seeks to elevate and communicate innovative, scientifically based, and impactful approaches to advancing early relational health. I'm really fortunate to have these sessions to share with you my most valued colleagues, thought leaders, and friends who inspire me as we try to advance this framework of early relational health and putting it into action. Today is a very special day for me as we close out this year with a timely and important conversation with 3 longtime friends that I'll introduce to you in a moment. But I want to set the context for today's session. The pandemic has really highlighted longstanding inequities in maternal and child health outcomes, particularly among communities of color and in rural communities, where often obstetrical providers are not even available. In fact, the U.S. remains among the most dangerous of the developed nations for maternal health and childbirth. Disparities for people of color are wide and unfortunately widening. Pregnancy-related death rates for Black mothers is 2.5 times that of whites, and for American Indian and Alaska Native mothers, the rates are 4 times higher than for whites. These gaps are widening during the pandemic. And for Black babies, the U.S. continues to have unacceptably high rates of infant mortality, Black babies dying at twice the rate of white babies. And even in the first 3 years of life, so many young children of color have less access to health care and a medical home, have less access to quality early care and education, and live most often in under-resourced neighborhoods and communities. These statistics are deeply disturbing to me. They haunt me, and they continually now focus on what do we do about this effort, especially under the pandemic and the economic recession. So we're in this striking moment where we're starting to see potential for evolutionary and revolutionary change. And we all have hopes as we recover during this Build Back Better moment. You know, there are multiple innovative strategies, including comprehensive approaches across public health sectors that can promote maternal child health and well-being if we are focused on transforming the manner in which our health systems are financed, the way we deliver services, and the way we engage as families, especially if we address historical and systemic racism and inequalities that have long been embedded in all of our systems of supports. But at this moment, I'm really hopeful about transformation, especially the impacts of policies, not only from the American Rescue Act, but also as we're poised with the Build Back Better Act when and if passed. These dramatic new policies offer once-in-a-generation opportunity for fundamental reforms of our healthcare and societal systems in support of advancing relational health that I think are really striking and important. So today's discussion, we entitled Transforming Health Systems to Ensure Maternal Well-Being and Early Relational Health. And I'm really honored to have the 3 people that I want to introduce to you, former Governor John Kitzhaber, Karen Howard, and Kay Johnson. Let me give you a few comments about each of them as I introduce them. Former Oregon Governor John Kitzhaber is a visionary health system leader. He was a practicing ER physician in Southern Oregon for 15 years until he joined the Oregon legislature, first within the House, then went on to be president of the Senate and authored that groundbreaking Oregon Health Plan. That was built on a list of health services prioritized on the basis of social values. That still continues. And then he went on to be Oregon's longest serving governor. And in his second and third term is when I met John, when I was the Oregon Pediatric Society president. And I was really honored in a small way to contribute to the design of the Oregon's Coordinating Care Organization agenda, to meet that triple aim of better health, better quality, and lower care. And I was particularly excited about in its continued focus on community and population health. There's a parallel structure that was designed of Oregon's early learning hubs, which are structures to support upstream prevention for communities and early childhood systems. And what really meant so much to me was a focus on kindergarten readiness accountability and really driving the whole system change toward improving well-being effort. John remains a frequent lecturer, a writer, a visionary leader, in terms of a deep knowing of the importance of upstream transformation, if not disruptive change, in the support of families and communities. And John, you and I have had many conversations over the years, and welcome today. I'm thrilled to have you a part of this. And then Karen Howard is a founding partner, Crossover Partners. She and I became great friends when we met when I was at HRSA. And we were at a number of tables, weren't we, Karen, when the Home Visiting Coalition was working on supporting McVie, home visiting. And she's had decades-long experience in early childhood policy, from being a congressional staff member to being a deputy attorney general in Colorado, director of policy at Nurse Family Partnership, VP of early childhood policy and First Focus, and policy director at the Alliance for Early Success. Her portfolio has been broad across multiple sectors in early childhood. She and I have chaired many conversations about relational health and work not only at the National Home Visiting Network, but also within the board of Child First. I'm really honored, Karen, that you and I are working now around policy work. And then Kay, Kay's president of the Johnson Group Consulting. Kay Johnson, a nationally recognized and acclaimed leader of maternal child health policy, researcher, lecturer, writer, advocate, consultant, 100 policy reports, national awards and recognition, actively advancing Medicaid and EPSD at federal and state levels, advisors to over 45 states. Her expertise is wide-ranging: perinatal and preconception care, home visiting, infant mental health, early childhood systems. But for me, Kay's been one of my dearest colleagues, confidants, and friends. It was Kay that actually called me unexpectedly on February 12, 2012, inquiring if I'd ever consider going to DC to join Michael Brew. I was stunned. I couldn't help but say yes. The rest is history. And I've grown a lot with Kay in terms of her guidance with me. So welcome, my dear friends. And let's begin our conversation with each of you having a chance to reflect some thoughts to this opening comment. We're in this unprecedented moment, this once in a generation opportunity to fundamentally reform our healthcare and societal systems in support of maternal and child health, early relational health and well-being, and to address structural barriers that have been disruptive to the well-being of children and families across this nation. So, John, could I come to you first as to your first thoughts, please?
Yeah, Dave, thank you very much for the kind introduction. And it's just an honor to be with the three of you this morning. And Dave, I was as surprised as you were when you disappeared into the Beltway. I'm really glad we reeled you back to and welcome home.
Thank you.
So I think that when we talk about this once in a generational opportunity, I think we're generally talking about the massive influx of federal dollars that are coming our way. And I guess I want to put the elephant in the room on the table where we can look at it. Notwithstanding the billions of dollars that are in fact coming our way for healthcare expansion, for housing, for childcare, workforce development, behavioral health, pre-K, and this whole host of other worthy and long overdue investments. All of those resources are at this moment going to fund a siloed delivery system that focuses on programs and organizations and agencies and institutions rather than on the children and families that all of these entities are ostensibly supposed to be serving. And I'm very optimistic, so don't take this as a pessimistic statement, but the fact is that all the money in the world will not break the generational cycle of poverty that's driven by the adverse community and adverse childhood experiences, or give each and every child a safe space in which to grow and thrive and become all that they can be, unless this massive infusion of public dollars is effectively focused on the children and families themselves, something that we have not honestly done a very good job. Here's the fundamental problem. In any given community, there are dozens, usually, of agencies, programs, community-based organizations, and institutions involved in providing supports and services that in one way or another seek to address early childhood and maternal health and well-being. In many cases, these diverse entities are dealing with only one of the major determinants: housing, for example, or nutrition, or job training and employment, or transportation, or behavioral health issues. The problem is that these programs are often fragmented, at least they are in Oregon, often operating in silos. There are many gaps. There may or may not be coordination between handoffs between one program and another. Often these entities compete with each other for the same funding sources. Turf issues abound, and organizational survival often takes precedent over the larger purpose for which these organizations and programs were set up in the first place. And I think we have to be really honest about this and look at ourselves. This is not a problem of federal funding. This is a problem about our will and our commitment to early relational health. And I think this is a much bigger challenge than funding. We all pay lip service to care coordination. And I mean care in the broader sense, not simply medical care. but true coordination. And if we want to achieve the objectives that we're talking about today, it's going to require that dozens of organizations and agencies and institutions and programs, and the people who work in them are willing to subordinate their organizational and programmatic and institutional interests to serve a larger common purpose, which is putting the children and the mother and the father at the very center of the equation. And it's also going to require something else that's hard that we don't do, and that's transferring ownership and real decision-making authority to the community itself, and empowering those that are most impacted to play the central role in shaping the programs and investments that are needed. And finally, it's going to require a frontline workforce of trusted members of that community, or people who are really familiar with that community, because it is these trusted relationships that allow workers to act as liaisons between the child and their family, and the community and the medical system and social services. I was in office during 9/11 when Congress created the Department of Homeland Security. And states, including Oregon, were just inundated with this massive flow of federal resources, and we had no idea how to spend it. And I think a lot of those dollars were frittered away, and I don't think the nation is more secure because of that huge expenditure. So my point here is that the problem is not the money. The problem is what we do with the money and how we actually create a sustainable system that allows us to make these investments. And the challenge, of course, from a political standpoint, is the ROI on these investments is going to be 6, 8, 10 years away. And it's really hard to sustain investments in this political environment when you don't have a return within a political election cycle. So yes, this is a tremendous opportunity. The money is flowing. And if we want to achieve our objectives, we've got to do now what we have failed to do in the past, and that is redesign and radically disrupt the current delivery model, and be honest that our job here is to serve children and families and to make sure that they have an equal opportunity to be as healthy as possible for as long as possible.
Wow.
That gets us started right on point to the movement, the power sharing with deep within communities, the disruptive nature, and more. How do we really put our arms together in terms of this effort? So, Karen, this speaks out loud.
Thank you, David. I want to first thank Kay for bringing you to Washington, D.C. and the whole visiting, because I didn't know I had Kay to thank for that. So I want to thank her. And I want to echo what John said. I don't think I could have said it any better. He laid out really the crux of the issue and the challenge before us. But I want to highlight a couple of things that you said. What's really haunting to me is the stats on Black infant mortality. And we know the March of Dimes came out with the report card last week that showed only slight improvements in infant mortality. Still, Black, American Indian, Alaskan Native, twice as likely their babies to die. We know about the maternal mortality rates, which are horrible overall, but most horrible for Black and Indigenous women. We know that mental health factors into this, with 1 in every 5 women who will suffer maternal mental health disorders like postpartum depression. We know all of these real challenges that we have. And I think, that really is a call to action to save babies, to save Black and brown babies. And I think, John, what you laid out, there is no shortage of money in the system. It is just not getting to the right places. And if this money from ARPA and Build Back Better and the CARES Act, if it goes to the same systems in the same siloed ways, we will have the same outcomes. We will be talking about these same disparities 2 and 4 and 5 years. And so I think the real challenge is to center mothers and families in communities and to value their experiences and value their wisdom, to listen to the supports and the community services that they want and need and how they want and need them. And I will say that, to re-envision early childhood, housing, transportation, and not in silos, but together in a cross-sector way. There was a saying, I can't remember who coined it, but collaboration is an unnatural act between unconsenting adults. And that's what we act like in this space, right? We act like we don't want to collaborate. But the lack of collaboration is the definition of inequity. And equity is collaboration. And what's interesting is when you don't collaborate, the systems collaborate to the detriment of children and families all the time. It's on autopilot. And so we have to figure out a way in which we can get the money and the resources deep into the community. I will just give one analogy that a really very bright, innovative woman shared with me. We have had disinvestment in the right places in our nation, in communities, in children, right? And in families and in those structures. And so we have a drought. And when you pour all of this money on a system that doesn't have the infrastructure to get the money to the right places, you have runoff. And only a little bit of that resources sinks deep into the soil. Our challenge now is to really rethink what we're doing and how we're doing it so that children and families are lifted up. And so I will stop there. And I know Kay's got some brilliant things to say.
Thanks, Karen. Thanks for helping us ever further. And Kay, your first initial reactions and thoughts?
Well, I couldn't agree more with John and Karen, and thanks, Karen, for your confidence and the quality of what I'm going to say. I just want to take us back up for a moment and say, this is the biggest shift in child and family policy in at least 60 years and probably in 80 years. But even more so, I would almost say it's the biggest change in how we think about supporting families ever in our nation's history. Because this, in some ways, because of what the Biden-Harris administration and the people who work there think, and because of some congressional leadership, this respects families and communities in a way that hasn't been there before. So it's not just about the color or the job where you work in, like Social Security was. It's not just if you're a single parent, like welfare income support was. It's not just if you're the poorest of the poor family, and if then you meet that cliff, if you're just getting barely ahead. It really, really revolutionizes the way that we think about supporting families. And, you know, this, I just got to say, this is no time for us to be complacent or fatigued. Many of you know I'm tired of everybody talking about fatigue. I think advocacy is as important as self-care. We got to do this, people. There will not be another opportunity in our lifetimes to see public policy change this much and to respond the way that John and Karen have described. My policy career started in the Reagan administration in the 1980s, and I've been working on maternal and child health policy since then. And I can't count how many times people have said, oh, if we could only reduce child poverty. Oh, if we could only reach more families and communities. Oh, if we could only address the barriers related to institutional racism. Well, we can. We can, but only if we make this make sense. At the community level and in a less siloed way. So I talk about this in 4 buckets. It's economic support, it's assistance with basic needs, it's protection of health and health coverage, and it's equitable and safe education from birth to age 21. If you count it all told, that's just ARPA. Right? That's just ARPA buckets. And then if you put Build Back Better, it's really continuing and enriching those things. All of it matters to early relational health. Family leave matters. Postpartum coverage matters. The child care quality and affordability matters. The reduction of poverty clearly matters. Mm-hmm. Cutting child poverty in half and reaching 90% of all families with children, that's really big, people. And then, so together, if you put the ARPA, the infrastructure money, and the Build Back Better opportunities together, we have an ability to address that whole circle of social determinants of health that so many of us have been talking about for a long time. I want to talk a minute more about Medicaid and its role in equity and all that, because that's really all I'm supposed to know most about here. So I'm just going to say 6 out of 10 babies, 2 million of the 3.8 million births in the United States rely on Medicaid coverage. 6 out of 10 Black, Indigenous, and Hispanic babies, and 2 million of the 3.8 million births. That's what's at stake in this Medicaid postpartum expansion. 2 million mothers and infants will be covered continuously for a full year. What are we going to do with that opportunity? We got to get beyond advocating for the coverage, just as important as that been. How do we make those healthcare systems and community systems work, use, leverage that coverage? We get into transforming healthcare. We get into medical homes that have relational opportunities, that have relational care coordination in them, that are supporting families' social, emotional, mental, and physical health, that deal with medical and social risks and needs. That's leveraging that coverage. If we just send somebody else a card and there aren't the providers and there aren't the systems change, it won't add up to what we want it to be. So let me stop with that thought and turn it back over to you, David.
Well, that calls out just last week, right? Vice President Kamala Harris had the White House call to action about improving maternal health. And within that, of course, is the Black Maternal Health Omnibus Bill with that opportunity for 1 year postpartum coverage for all mothers with Medicaid financed birth. So, how do we lean in? I mean, Kay, you were commenting, of course, advanced medical home, connecting with families, partnering deep within communities, multiple levels of support of vulnerability in pregnancies. But how do we dig in? And John, do you have some thoughts here, or Karen?
Well, of course, I have some thoughts. Yeah, relevant. I don't know, how should I put this? So we should celebrate the 1 year of postpartum coverage. Absolutely. And at the same time, we should recognize that postpartum coverage exists in a larger context.
Yes.
If all we do is provide postpartum coverage,
Yes.
the family continues to have mental health and substance abuse issues. If there is no pathway to a family-wage job, if they have housing insecurity, it doesn't matter if we've reduced childhood poverty.
That's right.
Right. So we have to connect the pieces, right? And we have to put this into a context. And that delivery system doesn't exist today. Right. And so one of the things we've been trying to do out here with this project that we call it the early childhood or the child success delivery system. But because the system doesn't exist, it's difficult to visualize. So we've been taking scenarios. So let me give you one really quick example. Let's just take a young woman, a girl who was born into a dysfunctional family. She is taken out of the family and put in foster care. And the family continues to deteriorate. So she stays in foster care. She has 8 different placements and she ages out at 18. She's now on the street with no job skills. She gets, trying to belong. She hooks up some bad, some problematic people. She starts drinking, becomes addicted to alcohol, and gets pregnant. So now you have this 18-year-old woman with a history of ACEs in her past who is about to become a mother with no skills and likely fetal alcohol syndrome. How do you take that woman and her child and make them successful? And we've got a dozen different scenarios that sort of covers the waterfront. And that's really the question. So get out of the programmatic thinking, my program, my service, my agencies. What do they need over the next decade to be successful? And I think that's the challenge. That's the exercise we have to go through, and then model the interventions to fit the circumstance. And by the way, the mother and the child have a lot to say about what they need and how they need it to be delivered.
Well, I learned a long time
John mentioned such a good point. I wanted to jump in and just say, often she will age out with children herself.
Yeah, exactly.
No supports whatsoever. And maybe her parents needed supports. And so if we have, you mentioned that the healthcare system that we want to see has not been built. The housing system we want to see has not been built. The economic system we want to see has not been built. It's a perfect opportunity now to think across that waterfront on how we build all of these systems to work together and how we put the families at the center. And how we finally address, right, our long-standing legacy in history that these systems were built on racism, on inequities.
Yes.
And they are baked in ways that are visible or in plain sight, but we can't see all of them. And so the gravitational pull, I just want to say, of racism is so great that we have to double down on equity. And often in a crisis, equity goes out the window. People act quickly. And speed is the enemy of equity, because you really do need to slow down and listen to communities and listen to what's important and really try to reconfigure them. So I'm sorry to jump in, but John said something that really got me excited, so I had to jump in.
I was going to jump in, Karen. I'm glad you kept talking. And I was just going to jump in to say, I learned a long time ago as an interventionist, as partnering with families, the power of relational supports to heal.
Yes.
And to build future possibility. Yes. And to have that happen for the next generation. And that all of that kind of relational healing and recovery and building is what all of this relational health work is about. And then making certain we get out of the way of all the barriers and make certain we have strong multiple levels of structures and supports so that people are not isolated with no hope, because that's where the power of recovery and resiliency can really build. Kay, your thoughts about what we're talking about?
Oh, I have a lot of thoughts about this, David. And, I'll just say, many people have heard me say this. I'm the only one of my mother's 5 children who graduated from high school. I'm the only one who's not a teen parent. I'm the only one who left 350 years of the culture of poverty. I really get it that this doesn't work for a lot of families. And I really get it that the whole system is structured with that institutional racism, Karen, that makes it much harder for a Black or brown child than it ever was for me. And David, one of the things that's been most exciting to me about your early relational health initiative is that recognizing the strengths of those families and seizing an opportunity to have us all think from all of those systems, as John rightfully says, siloed systems, but from all of those perspectives, how are the people who engage from the government professional sides strengthening families, listening to families, believing in family strengths and empowering where they can, getting out of the way where they need to. Mm-hmm. But to say, we need the home visitor to be doing that. We need the community health worker to be doing that, the doctor, the community, the mental health workers to be doing that. We need the person who's at the front desk in the housing system and the person who's at the front desk in the employment system. When I graduated from college and moved to Buffalo and went to look for a job at what I actually thought was the employment office, the woman there told me to go home. She said, "You have no idea what you're up against. Go home to your family." And I said, "I'm 21 years old. I'm a grown up and I just graduated from high school. Are you going to help me find a job or not?" We need to have that person be saying, "I'm here to help you," not go home, not go back where you came from, not go back to your broken, disinvested neighborhood.
Yeah.
You mentioned mental health, and you all know that I've been, pounding from the rooftops about preventative mental health. And just last week, the Surgeon General, Vivek Murthy, released an advisory, Protecting Youth Mental Health, noting the importance of this growing crisis. Realize 1 in 5 children in school age have mental health diagnoses, and many of them are not receiving interventions and treatments. Right. And I have said publicly, we're not going to stem the tide of this mental health crisis by therapy. This is a public health agenda, and it's upstream about supporting families and communities. So recognizing that in this moment of time, how do you think about moving this preventative mental health strategy into the center of these transformational activities and getting out of mental health paradigm into promotion and well-being development? What are your thoughts? Karen, John, Kay?
Well, sure. If we right now we have what's called I call it a front end back end problem. We're spending more and more of our public resources on the back end dealing with the consequences of racism and poverty and neglect, et cetera, and we're pulling it out of the front end. So we have this opportunity to kind of begin to turn that around, but you're not going to be able to do it all at once. And if I can use an analogy, let's say an airplane takes off from Portland to New York and it's 1 degree off course, right? It's going to end up over Montreal.
Wow.
But fortunately, there are waypoints in any commercial flight, right? And so it's going to be easier to correct that trajectory. Let's call this the success trajectory, the success being getting to New York, over Boise than it is over Chicago. And at some point, the course correction is so radical you can't make it. Well, that's where we are. And I'm a great believer in, if we're going to start doing this, we should start with conception to the first 1,000 days of life, to take into account epigenetics. And if we could first design our system to stop throwing the babies in the river, it's manageable. And let's say you started with a Medicaid population, which reflects the inequity, which reflects the racism. And let's start there. Let's build that system. And the role of the medical system is the medical system, at least in Oregon with the CCOs, that's the system that sees these mothers and kids very first, before they get to education, before anything other than maybe daycare. So let's start there and then build that forward, because as David says, we have to do everything we can to help with the mental health challenges of a generation of children and their parents and their teachers, I might add. But we can't lose sight of the fact that this is ultimately a prevention problem.
Yeah.
Right. And we have to wrap it in the robes of health and well-being rather than disease.
Oh, bless you, John, for speaking this way, because that's so where this work is. Kay, you look like you were going to jump in.
Well, so he's absolutely right. Just to quantify that, 90% of children get multiple primary care visits in the medical system in their first year of life.
Right.
Yes.
And less than half of them have something we can categorize as a real medical home, let alone one that actually includes the kind of supports and vision that we think about for a good quality medical home. And if you are a child of color in a disinvested community, the numbers of visits don't necessarily go down, but the quality of the care that is accessible to you physically is likely to go down. And so I've been saying a lot, there's no equity in health equity unless we fix Medicaid and the way that it delivers services and the quality of what our expectations are about, 60% of the women get a postpartum visit overall, and it goes down in many states. Less than 40% of women in Medicaid get even one visit to follow up on their pregnancy. Who's checking on their mental health and wellness? Who's checking on their ability to care for the baby and their feelings of competence and the need for support? And then if these babies aren't getting in also, but John, less than half of those kids actually come into a regular childcare setting. Right. So health is where, it's the old thing about going to the bank where the money is. Mm-hmm. Health is where the families are, and we've got to make that work.
Right.
What if we were taking the Medicaid program? What if we were to say for a 2-year period, that's a biennium in Oregon. Let's say we're going to do it for 2 biennium. We're going to assign each first birth or birth in the Medicaid population, not only a primary care medical home, let's call it a primary care community home. So they see the physician, but they're also connected with somebody who can assess the risk factors for that woman and that family. And not only do they get the medical care, they get the social support services that are necessary for 2 years, for gosh sakes. That's not very long. You can see the end of that.
I get very felt about the doula movement, the community health worker movement, the community navigate movement, and the organizing around supports around families and neighborhoods strikes me as being the moment of possibility. I want to come back to that because I don't want to lose track of something, and that is fathers. A baby doesn't happen without a father. Secondly, the predictions of outcomes of all kids has to do with the presence of a relationship with a father in some form. Thirdly, half of the babies born are boys. And yet, when we talk about maternal child health, when we talk about babies, we often forget the power of male relationships and fathers. And I'm just curious how you all, what you're seeing, what you're thinking about, how that enters this conversation at the same time.
And David, can I just say, I love that you mentioned that, because in the context of the Black family and Black fathers, you really have to look at the waterfront, right? You have to look at policing and police violence. You have to look at all those issues. So while we're talking about fathers, right? We have to specifically look at all of those systems of oppression that fathers and Black men and boys deal with, right? The incarceration rates and all of that. So I wanted to bring that into the discussion. But I also wanted to say, when we think of child rearing and childcare and others, we tend as a society to think of that as a women's issue. Even now, while we're talking about childcare, and we really do need to reframe that as a family issue. That is absolutely a father's issue as well. And stop with the patriarchal, well, we'll name this, that's women's issues. And so I will say that and pipe down, but I wanted to lift that up.
So it goes, I'm going to go back to the child tax credit.
Yes.
And again, the distinction here that, if you go back to Theda Skocpol's book, Protecting Mothers and Soldiers, if you go back to all of our social history and back to the New Deal, and then on through who got Medicaid and who was in the welfare system, all of that worked against family formation and family cohesion and fathers being in the system. And I don't fully, from my today's modern world, I don't fully understand. I think it was really just the saying, oh, these are the most vulnerable mothers because there's no father to provide for them. So the government has a role in providing for them. When we got this time to the tax credit, this administration and this Congress did not say, only if you're a single parent do you get this kind of support. Only if you're a single parent do you get this income support, child tax credit. Do you get this childcare support? Do you get other kinds of supports that are built into these pieces of legislation? It's revolutionary in a way we've not been thinking about it. And the social scientists at the National Academy of Medicine and elsewhere actually have been refuting, some of what people say, what are those families going to do with that money? Oh, they'll go off and be irresponsible with that money and doing all of that. And yet what they tell us, and the studies bear out, is that whether they buy better childcare, whether they move to a safer neighborhood, they get a car that enables them to get a better job, or they buy an enrichment for after school for their child, all of those things are going to create greater success in this next generation. And so it's the sheer ability to say you're a family with a child, you've got a working family in wage-based income, and our country wants to help you do a good job. It's extraordinary.
It's extraordinary too, because it can bring back in moments of relational experiences.
Yes.
It can bring back in the value of those, in the moment experiences that matter to all members and are critically important for young children. And that's, to me, the exciting, unprecedented moment that is happening in the, but also how do we call it out ever more clearly? And I want to lean in further, and that is, okay, so what are you seeing that's in action that could show, that are showing progress? What are you witnessing? Little examples of what's starting to move. I'm curious what you all are seeing, because we know where we've come. We've got this incredible moment of things shifting. What are you seeing that excites you, that you really think is leaning forward?
I want to call on John's point and say, I don't see it yet. I see, so I see everybody still working on coverage, not how we leverage that coverage into meaningful services. Everybody working on getting the money out the door out of those federal agencies, and not really paying much attention to how those decisions are made, to empowering people to come to the legislature or have public hearings or community meetings so that we actually understand what people need and get those investments. But John, from the point of view of someone who understands governance so well, what do you think we can do if you don't see the bright spots yet?
Well, leadership matters, and we have to reframe the debate. The Oregon legislature, and you correct me if I'm wrong, when they're awash in money right now. I believe they gave each legislator $1 million to each House member. I think $2 million to each Senate member to spend pretty much however they wanted in their district. That's $250 million, right? I mean, this isn't, when money comes in the door, let's start new programs, or let's pump up the existing programs. We need people talking. We need a different analogy. Let me try to give you one. Maybe we can work on this one together. So let's call this the House of America. It's almost 250 years old. The roof leaks. The windows don't fit. The family that lives in it has changed a lot from when it was built. Right? They have different needs. The rooms aren't right. The kitchen is not configured right. Some of the foundations were built on racism. Some of the foundations were built on exploitation. Some of the foundations were built with materials that were state of the art, in the 1700s, but don't make sense today. Mm-hmm. Pandemic has knocked the House of America to the foundations. We have the opportunity to rebuild it. Mm-hmm. Right? And I would add to that analogy, because I think we need to make this understandable to people, right?
Right.
I think that the greatest threat to America is not international terrorism. It's not the trade deficit. It's not the congressional gridlock. It's the fact that 60% of our children arrive at school with one or more risk factors that profoundly affect their ability to survive. So huge disparities based on race and geography, et cetera, right? You can't protect those children from those risk factors by building a wall, and you can't solve those risk factors by putting more money into the existing system. You can only do it by building a new house that's built for the needs and aspirations and future of those kids and their families. So I just think we need a different way to talk about this, because it's easy to get into the weeds real quickly on this issue.
So John, does that mean digging deep into some chosen communities to do it? Finding leaders in neighborhoods, communities to actually work collectively towards that kind of rebuilding structure? What do you think?
Yes, I think that you have to have pilots. The Congress isn't going to do this. It's going to happen at the state level. In the states, it's going to happen at the local level. So that's manageable. Let's just say you took All Care, which is the coordinated care organization in Southern Oregon, and that's a Medicaid program. Supposing you started there with that population, that's the population you're going to work at. Yep. And I do think with the CCOs, although there hasn't been a change yet, the last 5 years has been a journey of discovery around mental health. Yep. They have realized that mental health and behavioral health issues and substance abuse issues are drivers of everything else in the healthcare system. So there's an awareness now. The question is, how do we capture that new awareness and put it to use in a way that actually begins to change the.
Okay, I'm going to push you a little bit. I am seeing some glimmers. Let's go there, okay?
Okay.
And glimmers that include organizing of community of people talking and sharing their experience to power. I'm certainly experiencing that in Portland, in the Already networks, where the voices of families organized from the CBOs to the community leaders, being able to have conversations with healthcare leaders and with others in saying, we want to participate in the transformation of a system. I am seeing some of that glimmer happening in Washington State, where the focus on community health worker transformation into the communities and medical home for the purpose of prevention, but also managing the mental health-based issues is a glimmer of opportunity. It's got to play out. There's a lot more to do. So I'm seeing some movement. I'm especially excited that there's so much discussion about parent voice, parent leadership, parent family participation in solution making. And yet I think that has to play out locally, then with leaders that can listen. That's a journey. And
it is a journey. And David, I see, across the country also, and this may be something Karen wanted to say as well, the role of Black women in leading this conversation forward has been extraordinary. And whether that's in the halls of Congress or in communities or in healthcare systems, in the election, I was
going to say the election in the reproductive justice frame. I do think there's going to have to be a fundamental reframing before all the other things fall into place, to your point, John. And I wanted to lift up the Black Child National Agenda, which was authored by the Equity Research Action Coalition. And it talks about 3 triple Ps. Protecting Black children and their families from residential, economic, and social psychological segregation and racism, promoting Black children's economic security, upward mobility, physical and mental health, But just as important, preserving Black children and their families' positive racial and cultural identity, heritage, language, and family and community strengths, which is hand in hand with early relational health, right? Which is really looking at the strengths. We've been here for over 400 years and have been survivors. There's something there. There are assets there that you can build upon to really change the system. So I wanted to lift that up too, the change in the framework, the ascendancy of Black women and families and men, and calling out our history and owning it and saying, and calling America to task to say, no, you're not going to change the history and whitewash it. We're going to own it, claim it, and how do we move forward into this new America, right? Where we all prosper. Racism keeps white people down as well, right?
Yeah.
If someone's in a ditch and you got to keep them there, that means you got to stand over the ditch. You can't do anything else, right? So I wanted to lift that up because it's an important part, and it's an important part for early relational health, that is so steeped in cultural experiences and strengths in a number of communities.
You know, Karen, I think it's a really important point, and I think it is a part of the reframing. You know, there's one of my favorite quotes is from a guy named Thomas Pynchon, who was an American novelist, and he wrote a book in 1973 called Gravity's Rainbow. And the quote goes like this: if they can get you asking the wrong questions, they don't have to worry about the answers.
Yes,
I think we're asking the wrong questions. And so what's happened, I think the glimmer of hope is we're starting to ask the right questions. We're starting to ask the right questions. You just framed a really important central one, Karen. And it's, you know, the importance of community health workers. We're getting there. We're asking the right questions now. So now we have to provide the answers.
Right.
Starting to come around to, I mean, I knew this conversation would go quickly because it's so inspiring, each one of you. And yeah, I'd really like you to bring me some closing thoughts as to, especially to the audience that's listening in, and what you would urge them to do. This is all important conceptualization, important frameworking, important moment in time. There's hope and possibility. But if you, each of you had a bit of a magic wand, what would you tell people to do today, tomorrow, through the holidays and into January? I mean, the action points really matter right now, I think. And I'm curious how each of you, what would you say to people you know outside of our deep knowledge and profession, the action points of people you know? What would you say? Okay, could I come to you first?
Yeah, absolutely.
And then John.
So I go to my back to my advocacy may be as important as self-care, because I want everybody to be activists at this moment. And I think it really begins with asking questions. There are a lot of forums, and whether it's your governor's weekly briefing on COVID, or it's a legislative committee that's talking about money, be present and ask questions. If you don't, you may have answers you want to bring, but at a minimum, ask a lot of questions. Ask the hard questions, and everybody can do that, I think, from every position. And then where am I going to go with my activism and my advocacy? I'm going to keep working on this notion of, if you will, a high value, a high performing medical home, because that's what I think I know how to help move, that does what I was describing and what John is describing, which is really to wrap around that family, to have relational care coordination, to bring a locus of connection to other services in the community, whether it's infant early childhood mental health or home visiting, and to think about that family more holistically, respectfully, and see it as their role to strengthen it. Driving that through Medicaid, you know, they're talking about a lot of social determinants projects in Medicaid and Medicare, but it seems to be all about the grownups. I want them to start talking about that in the earliest phases of life. And so that's where I'm going to be using my advocacy and activism, but I hope everybody finds their niche to use their advocacy and activism.
That's wonderful, Kay. I would say, and you know, always, and what about the babies and their caregivers? I'm always focused on keeping, what about the babies and the caregivers, that relational health element. So Karen, what are your messages?
You know, Kate hit it. When we talk to folks, leaders, regular folks, they always point to, they want change, but someone else, they think has the power to do it. Why didn't they do this? Or they should have done this. And I really love to turn it back on, well, what did you do from where you're perched, and the people that you have influence over, the people that you talk to. And so I want to pick up on what Kay said. It is all of our jobs to save babies. It's all of our jobs to save Black and Indigenous babies. It's all of our jobs to right this wrong, right? And to build this house that now is at the foundation. And we're at such a critical point because the pandemic laid bare where these systems, well, they were raggedy for everybody. They didn't serve anybody, right? And so I really want to put it on folks to contact their local officials, their county commissioner, their city council, their mayor, their governor, their members of Congress. And we don't like the way it is, we want a fundamental change, and we want to invest in babies. We want to invest very early in families. And so where I think we also have to really demand that we not, take our foot off the pedal on racial equity. We are going through a reckoning right now, and it is uncomfortable, but it is a necessary step to get on the other side. And I would really urge folks to go through their personal journey as well as their professional journey from where they are, and see the inequities and open your eyes as never before. There's so many resources now on that. And so that gives me hope. That gives me real hope. And that's what I'm carrying into 2022. Never stop.
That's phenomenal. It makes me think about also bringing to every physician encounter from a family standpoint, I want more. Mm-hmm. And I want you to listen to me. Mm-hmm. Or I want you to value my strengths too.
Exactly.
Or how are you going to help me with the relationships and the challenges in my family?
Right.
Creating a consumer push also for health system change. And the docs are listening, but they're not exactly sure what to do yet. And that's a touch point where, John, your sense of the child success delivery system transformation is it's almost truth to power, family need and hope and possibility, and shifting the system's response. So a consumer-driven effort becomes really important in that messaging too, that relational frame opportunity. So John, let me come to you. Your thoughts about what are you saying to people to do now?
Well, I can't add. You guys have taken all the wind out of my sail. The two of you really add much to that. I will just close with this. I'll try to maybe be a little broader. I came of age in 1968, 21 years old, which was an era not dissimilar to this one. We had, race relations were right at the top. We had riots. We had an unpopular war. We saw the assassination of Dr. King and Bobby Kennedy. And I learned over the next 50 years that, the way that we try to move beyond these kinds of things ultimately is by having a shared vision, something that we all care about, something that's so important that bigger than ourselves, that we're willing to sacrifice for and invest in. Mm-hmm. And I think today people are hungry for community. And I guess what I would tell people is we cannot give up. We cannot allow ourselves to the extreme voices on the left and the right that are trying to exploit, the insecurity, economic insecurity, and the inequities and racial disparities. That we cannot surrender the field to those voices. And if there's one thing people care about, it is children. You can go to any part of this state and any community in this state, and they care about their children. So it seems to me that a child and maternal health, making sure that every child has an equitable opportunity and a fair and just chance to exceed and be healthy and be all that they can be, is that common ground. And I would tell people to look there. If you can't find it anywhere else, let's agree on that one thing and put our energy into that. And from that point of light, I do think we can begin to heal some of the divisions that are just shredding the fabric of our society, and we don't need to let it happen. Let's let the children lead us out of it.
It's that generational thinking that I'm so committed to, as all of you are, and that sense of connectedness matters. It really matters for the young ones, but it matters for all of us. It matters for all of our communities and our generations. That's also what I think is coming visibly more and more, is that connections matter, relationships matter for all of us at every level, especially now, and that's in front of us as an opportunity. Well, we're coming to our time having been together. I'm really incredibly thankful for each one of you for joining me on this journey, both from where we've come, but also into our future, into 22 and onward. And then for the audience that's listening in, we're going to be continuing our Willis and Friends into next year. In January 19th will be our next gathering. That'll be same time. And I'm hosting Tyler Norris from the Wellbeing Trust and Michael McAfee from PolicyLink, talking about transcending barriers of whiteness for next generation well-being. Continuing this same theme of opportunity in front of us, all thinking about well-being, all thinking about the relational elements of connection, all thinking about the power of a relational health framing for future well-being and generational work. So again, good holidays to you all.
You too.
Thanks to the three of you, my dear friends, for the time together. And I wish you well. And to the audience, thanks again for listening in.
Thanks,
Thank
Dave.
you.
Thank
Good to be
you.
here.